Welcome to Always Ageless, where we tackle topics that matter to you and your loved ones. Today's episode is all about Medicare. And if you think that it's just for your parents or your grandparents, think again. Whether you're approaching eligibility, you're eligible yourself, or you're helping your parents make sense of it, or simply planning for the future, understanding Medicare is crucial. Our guest today, Jennifer Lee, is a Medicare expert, and she's here to demystify the process and share tips that could help save you time, money, and stress. And if you're like me, Medicare is a big mystery. So I'm so excited that she's with us today. So whether you're 55, you're 85, or you're 45, there's something here for everyone. So stay tuned, because the choices you make today could impact your future and save you money and stress in the years to come. Welcome, Jennifer.
Thank you, Valerie. I'm so excited to be here.
I'm really excited to have you. Jennifer, first of all, give us just a little bit of your background. Tell us a little bit about yourself.
Sure. I'm Jennifer Lee. I've been licensed for over 20 years as an independent licensed insurance agent and broker. I do have an office in Anaheim Hills. I'm an agency owner, and I just love to spread the word about Medicare and how it works, because it could be quite confusing for someone that's not in the field or licensed or certified.
Absolutely. I know it's, and I hear so much, and I hear about it's enrollment month, and like, I just don't understand all of this. So I know that I can't be the only one that has these same concerns. Tell us exactly, let's start at the basics. Jennifer, what exactly is Medicare, and who is eligible to enroll in it?
Sure. Medicare is a federal program where when you turn 65, you could actually get into that program just as long as you work 40 or more quarters to get Part A, which is the hospital, for free at $0 cost. And then Part B, there is a premium to that. If you have disability, though, and are on Social Security Disability, SSDI, you can get Medicare after 2 years. So there are people that are on Medicare that are less than 65 as well.
Okay, all right. So the first and the basic qualification is you have to be over 65.
Correct. Yes.
Okay, unless you have a disability or some of these other things, which we can talk about at another time. All right, so many people, and so we're just going to try to break this down for people like me who don't understand all of it as much as you do. So many people hear about Medicare A, B, C, or D. Can you break down what each of these covers and why they're important?
Sure. So Part A is the hospital portion. So that means everything that happens at the hospital. Skilled nursing is on there as well, and hospice. So Part B is the medical portion, or your doctor portion, meaning everything besides the hospital. So that's your doctor's visits, your specialist visits, your labs, your x-rays, your surgeries. So everything but the hospital. Does that make
And
sense?
Part C?
Part C is actually A, B, and D to make Part C, which is called Medicare Advantage. So these are plans that you could enroll in besides just original Medicare that the government provides. Then D, D is drugs. D is the drug portion. So there's really two aspects, three aspects. You could stay on original Medicare, which is provided by the government, and get Part A and B. And remember, you have an invisible D, which is the drugs, and you have to get a drug plan. If you don't, you'll be penalized 1% for every single year. No, 1% for every single month that you're not on a drug plan. So that's original Medicare. Then you could actually enroll in a plan. So there's two types of plans. Medicare Advantage, which is Part A, Part B, and Part D together to make Part C. Or you could get a Medicare supplement, which supplements your original Medicare. And so that's when it gets quite confusing for someone to go on which plan.
So what are the key differences between the original Medicare and maybe you've just told us between the original Medicare and the Medicare Advantage?
So the biggest difference is now in a Medicare Advantage, you're actually taking over, the insurance company takes over the coverage of original Medicare and takes full care of the senior. So that means there could be in-network, out-of-network. There are different types of Medicare Advantage plans, which are HMO and PPO. So that is also the difference, right? Because do you want an HMO or do you want a PPO? And then besides that is the original Medicare where you could supplement it. And that just means that whatever Medicare doesn't cover, that supplemental plan will cover that for you. So
we're gonna have to do two episodes. I can see that already. So no wonder it takes a whole month for Medicare Enrollment Month, huh? So why might someone choose Medicare Advantage over the original Medicare?
Well, Medicare Advantage plans do have more benefits. If you hear all those commercials with dental, vision, hearing, groceries, utility cards, you name it, there's all these benefits, and it's an all-encompassing plan where everything is covered in that plan, and there's a maximum out of pocket. So it's more as you have low copays, maximum out of pockets, which is great for budgeted seniors, right? However, there is usually a network. So there's in networks, there's out of networks. So you are beholden to that network. You have to stay within that network.
And that's with Advantage or with the original?
That's Advantage. So with an original plan, Medicare and a supplemental plan, you could actually go anywhere where Medicare is accepted. You could go out of state if you want to see a specialist, a primary care physician. You are not limited. You could pick up the phone and just make an appointment. Just as long as they accept Medicare, you're able to be covered by that person, that treatment or doctor or hospital. Versus an Advantage plan, Part C, you're definitely limited, right? It's going to be in your own county or geographic location, or if it's a PPO, it's just limited to that network. Some you can go out of network, the costs are higher.
So what if I'm traveling? What if I'm in Phoenix and I have to go to the hospital or the doctor? Then I might not be covered?
No, so you will always be covered for emergency and urgent care. So if you do have an Advantage plan, you are still covered with that for emergency and urgent care. You just can't go like, oh, this seems like a great doctor, let me just do my preventive wellness. That's not going to be covered. And also in regards to supplemental plan, you are covered because you could go anywhere as well.
All right, so how do Medicare supplement plans fit into the picture? And what exactly is that?
Okay, so the Medicare supplement plans really help insure and cover what original Medicare doesn't cover. So in original Medicare, the Part A hospital, there are deductibles and per stay visits when you go to the hospital. So that will be covered when you get a Medicare supplement plan. So the biggest thing on original Medicare on the Part B side is there is an annual deductible and a coinsurance of 20%. So let's just say you have a $100,000 surgery. If you were only on original Medicare, you would actually have to pay 20% of costs, which would be $20,000. So an original Medicare plan with a supplement, that 20% is covered by that insurance company. So it's
And great. Is that like Aflac or?
No. It's called a Medicare supplement plan.
Okay, so that's not the quacking duck. That's not
no. It does. It's very similar on how it supplements your plan, right? So you do have to pay an extra premium for that every month, and of course, rates do increase just like regular health insurance does most of the time, right? Sometimes it can decrease, but more than often it will increase based on inflation. So you do have to pay that. So for someone that wants total freedom to go anywhere they want in the United States that Medicare is accepted, they will choose a Medicare supplement plan. However, if you're just like, you know what, I want to just stay local, no matter what happens, I'm okay. with going to the specific doctor or specific group, then the Medicare Advantage plan might be a better option for that person, because cost-wise, monthly premiums, they're usually they're at zero cost, or some type of premium, but not as high as a Medicare supplement plan.
So let's talk about, I have a specific situation. For example, my husband's still employed. He has insurance through his company. So when I go to the doctor, I show them my Medicare card and I show them my other card that we have. So why do I need two insurances?
So you probably just have Part A, I'm assuming, or do you have Part A and B?
I don't know, but I'll ask as soon as this call is over.
Okay, so that's the biggest thing, right? Because we definitely don't want you to have double coverage and double pay. You want to save your money. So if you are on his plan at work, then that's okay, right? Because you're covered by Credible Coverage, which is a group insurance plan. So that's fine. You are not going to get penalized. In most cases, you probably have Part A, which is hospital, because it's $0 cost anyways, because if you work for more than 10 years or has a spouse that worked for more than 10 years, you're eligible for $0 cost. So most probably you do have Part A. Then your husband still has the Credible Coverage that you're on, just like a regular health plan. If you do have Part B, let's take a look at that, because the thing is, you don't want to double insure yourself. Basically, you're paying for Part B. Part B is like $170 and some change for this year. So if you're paying that and you're paying for your husband's health insurance too, you're double insuring, which might not make sense. And if that's the case, you would really want to look at how much you're paying on your husband's, the coverage that they have versus Medicare and what Medicare offers, to see which one would be best. I wouldn't double insure. I mean, some people are just like, I'm okay paying, right? But if you want to save some money, we could definitely look into it.
But it really doesn't help you, because double insure, you're still only going to come, you're still only going to pay what the costs are anyway. So double insuring doesn't mean you get the leftover money if you have extra money.
No, you don't. Yeah, right. You're paying two premiums. And so I would highly suggest looking exactly on what you have.
So I'm thinking of another situation that might apply to some of our listeners. So in the case of my mom, she has Medicare, but she also, when my dad died, he had insurance through his union. And so she kept that insurance, which covers her drugs. And so you're saying maybe that she doesn't need that. If she had Medicare Advantage, she might not need extra insurance for drugs. Is that correct?
Yeah, we would have to take a look at it to see what's going on with that, because unions, now that's going to be another, I would say, topic, because unions do provide that, right? And it's more less, how much does it cost you and what type of coverage, because not all union plans, not all group plans, not all plans are the same, and it's really good to review your individual situation.
So it sounds like for the people who are listening and watching to this, they're going to need to look at their individual plans carefully.
Yes, the biggest thing is I do work with a lot of turning 65, and for most turning 65s, I would say a majority of them are still working, right? Because they want to get to full retirement.
Sure.
And so what's happening is, do I have to get something? I'm so scared to get penalized, because we're always like, oh, don't get penalized. Everyone's saying get on Medicare, right? But it might not be worth it to get on Medicare if you're going to pay the Medicare Part B premium and also have group insurance. So at that point, it's just an analysis. What would be better for your situation? Would your group health plan be better for you, or would getting on Medicare? And I would just say there's just so many varieties of different things that come to factor that, like how much your costs are for your health plan, your coverages versus Medicare, and are you doing any existing surgeries, your drugs, your health, how does it look like? So there's just a lot of factors.
Obviously there is. So what about if somebody misses their enrollment period?
So that's the biggest thing. When you are turning 65 and not in a group health plan, so meaning you are on a individual health plan or have no coverage please get on Medicare, because if you don't, you will be penalized for every single year you weren't on Medicare 10%. And I've seen those, and it could get quite costly. So it's at least, talk to a professional licensed insurance agent to make sure that you're on the right track.
Yeah, so I guess I kind of think that it would, like, the government would like it if you didn't sign up for Medicare.
Yeah, sometimes I feel like, why so many rules and to get to penalize you? I'm not sure, because there are, those two are the biggest. If you don't get on Medicare, you get 10% penalty every single year. And if you don't get on a Part D drug plan, that's another cost of 1% for every single month you're not on there. And some people, they say, Jennifer, I'm so healthy, I don't need the prescription drugs, right? And I get that, but look at the cost, because then I do have clients in their 80s and their 90s, and something bad happens and they need to get on a medication. It's going to cost them 10 times more if they didn't have a drug plan. So still an analysis to see, okay, even if you pay for that penalty, does it make sense to still get a drug plan? So things like that. And drug plans, it doesn't have to be like quite expensive. So, really look into that. If you're like, I don't need that because I don't have drugs, you just never know.
So is there a reason why people should review their Medicare plan every year? And should it always happen in October?
Yes. So annual enrollment period is from October 15th to December 7th every single year. From October 1 to October 14th, you can discuss plans, but you cannot enroll. The biggest thing for next year is the Inflation Reduction Act. So this was passed a few years ago, which is great, right? There's some things that were really good, such like vaccinations were zero cost, shingles were at zero cost. That was like a major complaint with seniors. So there's different things like insulin is at $35. And next year, the biggest change is that the maximum out of pocket on drugs is $2,000, which is awesome, right? For seniors that are paying $4,000, $5,000, $6,000 in their drugs, and that dreaded donut hole, if you've heard about it, is when seniors pay way more on their drugs. You can't quite get out of it, but that's going to be eliminated next year, which is great, right? Max $2,000 on your covered drugs. However, because of those costs, insurance companies are thinking that they are going to lose revenue and profit, right? So what they're doing is, specifically Medicare Advantage plans, they are cutting back on benefits. So I'm seeing benefits cutting back in half. So there are companies, insurance companies, that, it's very steady. They haven't made a lot of changes, but there are insurance companies that are making tremendous changes. And I've been meeting seniors already, was like, Jennifer, thank you for meeting with me, because I had no idea I'm getting half of the benefits next year and I have to qualify. And it's just like, thank you for letting me know, because seniors are relying on these benefits. So we kind of have to adjust and make sure they're on the right plan for next year. And the biggest thing is, usually there's 1 or 2 changes on Medicare plans every single year. Now it's going to be 10 or more changes per insurance company in their plans. Even as a licensed agent that I'm certified every single year, certified with every insurance company, there's so many. Plans are terminating, which is the biggest thing too, right? If you're on a plan that's terminating and you don't know, you don't read your mail, you're just letting it roll,
Sure.
You're not going to have that coverage that you thought you had. So that's one of the really crazy things that are happening next year. A lot of terminations. Some plans are not being offered anymore, but clients are still keeping it. And then just the drug portion, right? We want to make sure that you are not paying a lot on your drugs if you don't have to. There are deductibles for drugs. Some plans don't. So that's the biggest thing, because now we have to make sure your drugs are covered. You don't want to be surprised come January 1st and like, oh my gosh, my drug is not covered or it's costing me way more.
Absolutely. And that's our next question. So, and then I'm going to go back to something you just said, but prescription drug coverage can be very confusing. And I know that there are people driving today that are listening to our program, or people that are watching it, and they're saying, talk about prescription drug plan. It's confusing. How does Medicare Part D really work? And what should people be aware of when choosing a plan?
Yeah, so it is confusing. So Part D is the drug portion, and there is a deductible. Some plans don't have a deductible for like different tiers drugs. So usually there's tier 1, tier 2, tier 3, 4, 5, 6. Usually the tier 1s and tier 2s are your generic or preferred generic. Your tier 3s are your brand name drugs, which is more expensive. So that's when deductibles come into play. So first of all, the senior needs to know if their drugs are covered, and then which tier their drugs are in and how much they're paying. So that's the biggest thing, because it could change year to year. Drug plans do change every single year. Some insurance companies will remove drugs out of their formulary. Some will add it in. Some would rather you get on a generic, right? And then there are ways, if there's a specific specialty drug that you need to be on, we can definitely help with getting approvals and exceptions to get that covered for you. But most seniors, they don't look into that. There could be rebates from manufacturers, also like good drug savings cards. So things like that we definitely could help with, just to help save money.
So when someone needs help with a drug, or someone, they get cancer and they've got to have a drug that's very expensive, you're the person they should come to for that advocacy, so to speak.
Definitely. I always like to call myself as an insurance advocate. I have it on my pens, my everything. Definitely, because there are things we could do, or finding other ways to get your drug for lower cost or cheaper. There's even foundations out there that help. And there are people that actually go to Canada, right, to get their drugs if it's going to cost less. But the nice thing, as I mentioned, is the Inflation Reduction Act. There is a cap of 2,000. However, I am noticing there are drugs that may not be covered that I'm seeing. So that's the thing where we have to look at, alternatives, talk to the doctor to figure that out. Sometimes they give samples before, that client purchasing that drug, just so, they make sure that they need that drug, especially if it costs a lot of money. So there's different things we could do and to help.
It's interesting because one of our earlier guests on our show a couple months ago was a gentleman who talked about this issue, and he's an advocate for retirees in Washington. And his comment was similar to yours, is that yes, everyone thinks that we're going to have a reduction, and a maximum of drugs is $2,000 or something. But what they don't realize is exactly what you're saying, Jennifer. So it's interesting to hear this from you also, is that some of the drug companies are going to say, we're just not going to develop those drugs. If we can't charge for them and we can't get paid, we just won't do it. So it's really not going to be for the benefit of the consumer if you don't get the drugs.
Yes, Inflation Reduction Act definitely is causing quite disruption. And on the outside, it looks very good, but there's just so many moving parts for everyone. So every person is going to be affected in different ways.
Yeah, it sounds, first of all, it sounds very confusing. And being in, as someone with a real estate and a mortgage background, and I think that's confusing, but it's not as confusing, I think, as what you do. So let's go a little bit, let's talk about that. Your card, Jennifer, says Medicare Made Easy, and that certainly is a good thing. And I'm sure that a lot of people would love to have your help with this. So let's talk about exactly why is it important to work with someone in your position, and if not you, does everyone have an agent that they work with on Medicare? Can you not have an agent, or what happens if you don't?
Okay, yes. So typically, if you don't have an agent, you go straight to the insurance company. I guess let's go first when you are turning 65 and you're just really lost and you don't know. And it's not just you that's confused. There's very many. It seems like they are making it really confusing for a person that hasn't studied this as their profession. So, first it's just understanding how Medicare works. Then the second part is, okay, should I get a Medicare Advantage? Should I get a Medicare supplement? And then is it time for me to get a plan, or do I stay on my group plan, right? So a licensed insurance agent should be going over just the basics of that, and then learning about your customized needs, knowing your budgets, your doctors, your specialists, your drugs, and just how overall you look at health and what your plans are, or how you want to live your life in retirement. Even I go that far, right? Just kind of knowing how that person. So we structure it, and then we could do a comparison on how a Medicare supplement would look like and how a Medicare Advantage plan looks like. And sometimes seniors know exactly what they want based on what I told them. And sometimes it's still kind of a toss up. And that's when I think the nitty gritty, because the little details on like, Jennifer, what if I want to start with a Medicare Advantage and then move to a Medicare supplement? And sometimes there is underwriting. Most of the time there is underwriting, but there's little nuances and caveats, which I could probably spend hours talking about on like, this and that and the rules, right? So once a person does pick their plan, yes, they could definitely go straight to the insurance company, but usually there's no name face, someone to help escalate your situation. It's just, you call that insurance company, you enroll. Your relationship is basically whatever they email you, whatever they write you in a letter, like standardized, and calling in for customer service. What a true licensed agent and professional should do is they should help you with the enrollment process, make sure everything's correct. If there's any servicing issues or escalation, we're there to help, right? Like for me, I go above and beyond as an agent to make sure that I'm advocating. There's a bill and you're questioning it. Don't pay it. Let us look at it. More than times, you shouldn't pay for it. And then sometimes people are just like, I don't want to think about it and pay for it. And you shouldn't. That's like number one thing. And there's sometimes situations where, Jennifer, my doctor left the network, or this plan changed, or we're the ones proactive and letting you know these are the changes throughout the whole year. Because I do hear clients say, I haven't talked to my agent in 5 years, or when I call them, they never answer. Or just one recently was like, I was helping their family member, and they're like, no, don't worry, I have an agent. I'm like, yes, that's great, you have an agent. And then after a while, they're like, oh my gosh, like my plan is so old, 5-10 years old, like it's such an unupdated plan. Like, where was your agent to tell you it's such an old, outdated plan? Things like that I've seen. So definitely we are here for our clients, and I think to work with a professional agent that's always there for the client, it gives you that peace of mind. I know there are people who are like, oh, I'll just go straight to the insurance company, but it's just an added level of support if you want to help you along the process. And for me, I'd love to have the client for life, and build a relationship, right? Like we go through so much knowing each other, like my kids, and then like, even their spouses passing away, just things like that. That's like, it's good to know that you have someone in your corner to really help you out.
This is interesting to me because when I met you and I listened to you speak at the meeting where we were, the networking meeting where we were, and I was fascinated. And my first thought was, how do you get paid? And I asked you that because I thought, and I can't be the only one. Maybe I'm not really smart, but I'm not the only one who must think this. I just kind of thought that it's a government thing, and so it's all the same. I didn't know a lot of these things that you're explaining to us. Although, as a real estate professional, I know that all real estate professionals are not the same, and I certainly know that people should come to us rather than go out and buy or sell a home on their own. But I didn't know that that was an opportunity for you. So when people come to you, and I'm sitting here thinking, Jennifer, of all the opportunities of people that aren't of Medicare age, but their parents are, and their parents don't know. And they're your friend, right? You play, your kids all play baseball together, right? Or go to school together. And really, they're your clients because they're the adult children of aging parents who our show is also for. And they should be telling their parents, you should be talking to Jennifer, right? So when they come to you, when people are looking for someone, when they hear us, they hear this, and other people are going to listen to our show and see our show, and they're going to say, I never thought about that either. So what are the questions that people should ask to determine who is the best agent or advocate for them?
Sure. I would just ask first, how long have you been doing this? Are you certified? How many companies do you actually contract and certify with? Because the biggest thing I see too is an agent, because there's a lot of certification involved. And let's just say in your area, there's 10 companies. If you don't certify for all 10 companies, you don't really know all the plans in your area. So usually once in a while, I see an agent that only has one contract or just one specific plan they offer. And it's just not one size fits all, right? Because one of
No,
the
of course not.
questions people always ask, Jennifer, well, what's the best plan? Really, there is no best plan because it's the best plan for that specific
That
individual,
person.
their needs, right? Yeah, I could name maybe top 3 to 5 that have good, stable standings, have been upstanding with seniors and not changing benefits all the time. However, like we really need to customize based on individual. And like you had mentioned, yes, I do have like say 40-year-olds with 65-year-old parents, or I even have 65-year-olds with 85, 90-year-old
Sure.
parents.
Yeah,
And
absolutely.
it's definitely rewarding to help, right? Because sometimes seniors, once they have their plan for 5, 10, 15 years, they don't want to look at it. Let's just let it ride, right? Because it does auto renew most of the time, right? But like I mentioned, some plans are terminating. So they're not reviewing their plans. And I had met a couple years ago. We saved them over $6,000 per year. So when her
Wow.
son got on Medicare, he called me, right? And then he has referred like his aunt, his
Of course.
cousin. So it's like awesome, just very rewarding to help, right? And like my stance is I don't like make or push someone into a product. I want them to be fully comfortable and understanding. And like I remember his aunt, like she was on a supplement for a very long time, 10, 15 years. And I, visited her a few times. And of course, like I do not want someone to feel uncomfortable, right? And eventually she's just like, the last time she called, she's like, I'm sick of paying all this premium. You know what? Like, let's just help me save some money on it. And same exact thing, coverage has not changed, right? Sometimes it's just getting help and, uncovering just educational on how to save money as well.
And Jennifer, are there specific professional designations as well? Like, are you licensed?
Yeah, so I am life and health license, and then I do have to certify with this is called AHIP every single year. Then within that, every insurance company, I have to also certify for every single year. So it's really good to use an agent that has all the insurance companies because your needs could change from year to year and you want to be updated. And sometimes there's new plans, there's a new insurance companies that come in that just people are like, I didn't know about that. And we're always about education, reach out. We always are very, take that initiative to make sure clients know and understand all the updates.
Yeah, certainly. I can see the value to having someone do, an annual, like community seminar and just invite people to come and listen to what are the changes this year and how does that make a difference to you. So Jennifer, is this kind of like your insurance that like if I wanted to change like from one fire insurance company to another, I could do that? So if people aren't with you now, they can change to you?
Yeah, definitely. I mean, sometimes I would even tell a person, we look at and review all their scenarios. And if that's the plan that works for you, I will tell you that plan, stay there, right? It's a really good plan. And then sometimes it's like, no, like you're telling me you need this, this, that, your drugs cost this much. We definitely could help you as well.
Sure. Okay. All right. So for people who are already enrolled, the best thing is for them to come to you and have you review their plan, correct?
Yeah, so we do annual reviews, or just any time of the year we could do reviews just to make sure everything's good and you're happy and you just know that you are on the right plan.
And if they've already enrolled for this year, because now it's October 13th, let's say somebody's just got right on it and took care of it the 1st of October, can they still make any changes or are they stuck?
Technically October 15th. So by rule and compliance, they could not have enrolled in a plan till October 15th.
Okay, so they haven't enrolled yet.
Yes, they're not supposed to.
But if they do on October 15th, and then they listen to our show and say, gosh, I want to talk to that lady, can they still do that?
You could definitely still do that because you
They can
have
do
till
that.
December 7th. So typically there are people that change their mind. So the last plan that you get on December 7th is the one that you're going to get on. But not to worry, because sometimes you either made a mistake, didn't do anything. From January 1st to March 31st, you could actually make another change. However, it's not marketed. Like I can't market and say, hey, I can make a change for you. It's you that needs to call and say, you know what, I want a review and I might not be happy, or I just want to make sure everything's good. Then you could actually change from January 1st to March 31st as well.
So one of the things that is, I'm sure, important and people are wondering about is what are the opportunities, if any, possibilities for care coverage for short-term care, long-term care, caregivers, in-home care. Talk to us about that, Jennifer.
So that is kind of one of the hardest topics to say, because really health insurance, Medicare, they don't cover per se long-term care, short-term care. There are things in like the Medicare Advantage plans that possibility if say you were hospitalized, then when you come home, they'll give you some extra care.
Okay.
Sometimes some plans have a little bit extra care here and there, but not a lot, maybe like 60 hours a year, right? Which is not very much, but sometimes it's more to alleviate the main caregiver. So that is a different topic, but definitely that's something, most seniors should plan before they get sick. Or now, with the sandwich generation, it's like, what can I do with my parents? Sometimes it may be too late. And fortunately, I feel like most of like the older parents that I have some type of long-term care, or they have really good pensions, which is great, right? So now it's time for that younger senior to think about, what happens when I'm in that boat, because pricing 8-10,000 per month to be in a like a facility, to like a senior facility, it's outrageous pricing.
They are outrageous, and we do a lot of work. We do help people make those decisions as a senior transition specialist. Part of my job is to helping people decide where do they go next. And it's the same thing as with you. So many decisions, and where is the best place? Well, what is your situation? So Jennifer, when someone's coming to you, what are the first three things that you ask them? What are the top three things they should talk about first?
For Medicare, right?
For Medicare. Yeah, let's go back to Medicare.
um I would say, are you happy with your current plan? What type of needs are you concerned about? So what are your really concerns? What are you happy with? What are you unhappy with? What are your concerns? Then I would say, like, budget wise, like what does that look like to you? Are you paying a lot in your drugs? What also, like, type of needs are you looking for the following year? And then third, I would say, like, it's just really an analysis of what they currently have or wanting to have, and just seeing if we could better their situation, or what they have is actually the best for them.
Can you tell us a story about someone you've helped with their Medicare plan where, and you mentioned earlier, someone that you saved them $6,000. Can you tell us how you helped someone, how it made a real significant difference to them?
Sure. I had a client, he got on Medicare 7 months before I met him. So we were on the 7th month. And he had no clue. I mean, he was an engineer, very bright, smart guy, of course, like in his field, but Medicare, quite confusing. So I had explained to him how Medicare works and just the coverages and how that works. And he was on original Medicare. So I had advised him, you need to figure out what type of plan you need to be on, right? Because you don't want to pay for all these excess costs. He did have heart conditions. So I
Oh,
couldn't put him on the plan he wanted because sometimes plans like the supplements has underwriting. So of course, we have to put him on the next best option. The HMO wasn't a really great option for him because he he had heart conditions and he wanted to go to different top hospitals and surgeons and primary care. So we had came up at least a PPO. So I actually just saw him the other day because I had a client appreciation event. He's like, you know what? I had surgery and had like another open heart. I'm so happy, right? He did have to pay a cost to that. But if he was not on a plan altogether, imagine it would cost him hundreds of thousands of dollars, right? So that definitely, I just feel like I really do help with situations like that, just making sure people are covered. He worked all his life. I mean, he's a professional. I'm sure he has money, but imagine taking that money out of retirement, his wife just passing as well, him
oh,
taking care of her needs, right? Because she had to be put on a facility and what cost $8,000, $10,000. So things like that giving people that peace of mind that they made a good choice, that they should make a choice before, things happen.
yeah, that's incredible. And I'm sure he's truly grateful. And I'm sure that there are people listening to this that say, boy, I wish my insurance agent would take care of me.
That's definitely.
Do you have a situation that has to do with drugs, with prescription drugs, where you were really able to help someone, and how were you able to impact their life?
Sure. So, sometimes, like I mentioned, seniors do not review their drugs. They just let it roll. It's easy every year, no
You
worry.
think so?
So I had met a really sweet lady, and just the premium on her drug plan was $200. $200. And sometimes you're not thinking because like it comes out of your social security. Your social security does
Oh,
increase every single year, right? You're just not looking at it. And she did not know her premium was $200. That's $2,400 besides the drugs, right? So just a little review to update her on the current drug plans for that year. I mean, there is a plan for like $1 a month. So imagine
um,
paying $200 premium per month versus $1. So, I mean, that's just a significant difference just by reviewing what you have. Your coverage doesn't change. Your drugs are still covered. You're probably paying less in your drugs. But with her case, I mean, that's like easy, savings of $2,400. And with that year, after that, there was regulation in place that insurance company can't like increase their prices by like $100 because this is what happens, right? With no regulation on that, that people are just letting it go and renew without knowing.
what is the most common fear that people have when they come to you about Medicare? And how do you reassure them?
I would say the most common fear is just making sure that they're on the right plan. Um, I had a client that was like Medicare supplement, Medicare Advantage, but based on his needs and affordability, it made sense for him to be on Medicare Advantage. And it was very quite new to him. Like, what is this? What kind of plan is this? But you know what? Like, few months after, he had like a brain cancer,
Oh,
so a tumor. So they had to do surgery. And he said, Jennifer, like everything went so well. My max out of pocket was 1,000, and that was it. So thank you. Thank you so much. Right. Like, just kind of relieved everything for him. So things like
Jennifer,
that.
one of the things that I see so often that I think is so sad is when we have clients or friends are ladies whose husbands pass away and they they didn't do things in the household as far as finances and insurance and so forth. And all of a sudden they're left to be in charge and to make these decisions. Have you seen a situation like that? And how were you able to help someone who may have just either didn't know or they made a decision that they thought was good and it wasn't, and you needed to help them correct it?
Yeah, I've definitely seen lots of situations like that, and it's just really first reviewing what they have and education. I'm all about education. I love educating and just making sure people understand how Medicare works and then their options to it, right? If that's right for them, then stay on. If it's not right, they want to save money, they want to get better benefits, definitely we're there. And also when they're ready to do that. Sometimes it does take a while, right? People don't like change. So that's the biggest thing. But then when they see the value, or just like I mentioned, that one person, like after a few times, she's like, I'm finally ready because this is just absurd, the prices I'm paying. And
Yeah,
it's a
sure.
level too, right? So, sometimes it takes longer for others.
Have you ever had a situation where the adult children of aging parents, as I am, as we are, um, how they got involved and they either didn't agree with you or they didn't understand, and it was difficult for you to get them to be a part of the decision making?
Yeah, it's definitely tough for the most part. Most, like, they'll listen to me and then make an educated choice decision for their parents. But once in a while, it's just too much for them that they don't make any decisions. So that it does happen too.
Oh,
But for the most part, they do listen and heed the advice that a professional offers.
do you ever find a situation where someone wants their caretaker to, or their caretaker thinks that the caretaker themselves should be the one to make the decision?
That happens too, right? The
It
biggest thing,
does?
like when someone has dementia or Alzheimer's,
Oh,
has to take care of that person and so forth. So that's like the biggest thing, making sure like their adult children or that caretaker, are both involved, because it's total care, right? It's a community helping each other, and with that parent situation.
how do you manage it when there's, like, say, two or three or four children in the family and they all want to have some input and they don't live close by, or maybe one of them does and the other three live in other states? How do you coordinate that and how do you work with the family dynamics?
I definitely try to have a meeting with all of them,
You
right? Just
do?
um, they know me, right? And then at that point, they usually make a decision and be like, you know what, my sister just needs to talk to you, and we'll take it from there. So that's usually what happens, is just get a call with everyone, just to so we're on the same page, right? At that point, they know me, they trust me now, and we can move forward.
Sure. And by talking to you, then they realize that you're not out for yourself.
Exactly,
And
exactly.
usually, as I'm sure you found, Jennifer, is that when you try to educate people, or when you come from a position of value and of educating, then they realize that you really have their parents' benefit at
Yes,
heart, right?
definitely. Yeah, like that's what I love about my job.
Yeah, it sounds like it. And it's very impressive. We have just a few minutes left. Tell us a little bit about your experience, and what are some of the most impactful situations that you've been in where you've really been able to help someone?
So I had a client that knew he had to have back surgery, and it was hard for him to get like the treatments for for himself. So we devised a plan to help him get into the right plan. But of course, sometimes it's a little bit more complicated to get underwriting done. The reason why he wanted to have back surgery was because his daughter was going to get married and he wanted to walk her down the aisle.
Oh my gosh.
Yeah.
Oh,
So we were able to get him the plan that he needed to get that done. So the things like that, or stories like that, like even patients with cancer, and just like, Jennifer, I want to get to the hospital in 2 weeks, not a month and a half. Like, what can you do to help? Or just like claims issues, because like the biggest thing too is navigating through claims issues, through benefits. It's a lot, right? We do this every single day. So it's easy for us, it's very easy and we enjoy doing it. So things like that, just navigating through that healthcare Medicare journey, and wellness, and being just healthy, right? And having that peace of mind that you're good, right? Because I think that's also the stress a senior could take on, and just so much burden. We want to take that burden off and be that advocate for that senior, so they don't have to worry about things. Three-way calls, like calls to Social Security, insurance companies, sometimes it could take hours. And what we do is we alleviate that, and we like, just be on by your phone, and once we call you, then at least we will have the representative on the line, because most of the time they won't want to just talk to us, even though we're the agent. I know they should change that in the industry. We do have their authorization or permission.
Jennifer, tell us how our listeners and our viewers can find you. Do you work with everybody? Do you only work with people in California?
I'm actually licensed in over 37 states. I
Great.
do have 4 admins on my team, so not to worry, like if I'm totally busy, and I have about 15 to 20 agents that could help as well. But like, I still love what I do, so I do help. You do call me. My number is 714-248-8255. And my website is premier360solutions.com. We're just here to help. A lot of seniors think, oh, what do you cost? And I'm like, I don't cost anything. It's $0 for no cost, no obligation. You're not going to feel like you need to do something, because I will tell you, you need to stick to your plan. It's a great plan. Or I'll tell you, you know what, like, your plan is so outdated, you're paying so much more. So it's just individual, customized to that person. And
yeah, I certainly am. I'm just so impressed and so excited that I met you. And that was one of my first questions, is how much do you cost and how do you get paid, and how can you have all this information and you don't have to charge anybody for it? So that was very impressive. Thank you, Jennifer. Tell us your website and your phone number again. And we're going to also, for our viewers and our listeners, we're also going to put that right here underneath her picture. So during the interview, you'll be able to see where to find her. And she'll also be on our YouTube as well. But tell us again, Jennifer.
So it's 714-248-8255. And my website is www.premier360solutions.com.
Thank you very much for being our guest. I know that everyone's learned a lot from you today. You brought a lot of value to us. Thank you very much.
Thank you so much, Valerie. Thank you.